An article published this week in AJR evaluated two CAD systems for detecting lung nodules on chest CT, FlyerScan, a traditional handcrafted CAD system, and MONAI, a deep learning CAD system. These were both written for adults and trained with adult data. The study tested the systems in children and in other adults than who were used for model training. At a predetermined rate of 2 false positives per scan, the two systems had sensitivities of 68% and 53% in children, which were significantly lower than sensitivities in other adults of 84% and 96%. I'm Andy Rosenkrantz, the editor-in-chief of AJR, and I'm here today to discuss the article with its first author, Russell Hardie, professor of computer engineering at University of Dayton. Dr. Hardie, thanks for being here.
Well, thank you very much. It's an honor to be here to discuss this paper on behalf of all of my co-authors.
What made you think to study this issue?
So I've been working on the detection of lung nodules since my first sabbatical about 20 years ago. And at that time, the issue was really detecting primary lung cancer in adults. So nearby, we have Cincinnati Children's Hospital Medical Center, and I visited some radiologists there, and they educated me about the fact that there's a need for assisted detection in pediatric cases, which is something that I hadn't originally thought was needed. And of course, we're looking for something different in pediatric cases. We're looking for lung metastases and not primary lung cancer. And they also alerted me to the fact that it's very challenging because the nodules tend to be, a little bit different than we see in adults. So we had this idea that we want to build a pediatric specific detection algorithm. But before, jumping into that, we thought we should test how do existing systems work on pediatric cases and figure out where we are and then proceed.
Can you tell us about the pediatric data used to test the two models?
Sure. The pediatric data set was originally collected as part of a prior study. That prior study was looking at comparing standard dose and low dose CT for radiologist detection of lung nodules. It did not involve CAD systems at all, but the data set was well suited for our current study on computer-aided detection systems. So the original data set had 78 cases with 78 scans for 78 children and young adults, ages 4 to 21. And we selected just patients that were less than 18 years of age, which was 59 cases, 4 to 17 years of age.
The mean size of lung nodules was 5 millimeters in children versus 11 millimeters in adults. How is this relevant to the results?
So there have been many studies that show that smaller nodules are more difficult to detect. I mean, it's very intuitive. Smaller nodules are easier to overlook. So smaller nodules are going to be more challenging for both radiologists and for CAD systems. So when we noticed that there was a discrepancy in performance, the obvious question is, why are we seeing this difference? What is it about the pediatric nodules that was different and more challenging, perhaps? So the thing that really jumped out at us was that the size of the pediatric nodules was so much smaller. So it stands to reason that these smaller nodules are going to be more difficult for the CAD system to detect.
What were other reasons that were discovered for the lower performance in children than in other adults?
So the nature of the nodules appears to be different. Now, we actually are looking at this in future work right now to look at this more in more detail. One of my colleagues refers to this is it size or is it size plus? Size is clearly the predominant contributing factor in finding the nodules more difficult to detect. But there are other differences as well. First of all, the anatomy in children is different. We have more densely packed vessels. We have just a smaller vasculature. And these adult trained systems are trained on adult anatomy, and therefore we're not fully expecting them to generalize perfectly to pediatric cases.
There are lots of CAD systems out there. Why did you pick FlyerScan and MONAI to look at?
Well, sure. Well, let me first of all explain what FlyerScan is. So here at the University of Dayton, we're known as the Dayton Flyers. And so this system was developed at the University of Dayton. And we, in honor of the Wright brothers, we are the Flyers. So we named the system the FlyerScan. This system has been ongoing work of myself and my students and colleagues for a number of years, and the system has evolved over the years. So because this is a system we developed in-house, it was an obvious choice for us. In addition, the system has been published, and we have a publicly available implementation that's available on GitHub. And the system performed very well in a competition called Anode 09. Anode 09 was the first lung nodule competition of its type. And the system finished in second place in that competition, and we have made improvements to it ever since. The other system, the MONAI system, we think is a good choice because it is a publicly available open source algorithm that performed extremely well on a more recent competition known as the Lung Nodule Analysis, or LUNA 2016. In LUNA 2016, the system performed in the top 5. It would on the leaderboard. If it were active, it would have performed in the top 5 in the leaderboard. So it's providing state-of-the-art performance. And what we really like about it is that it is open source and publicly available. So our results can be reproduced by other researchers.
Ultimately, what is needed to address this issue?
So what we think ultimately is that pediatric-specific data is needed, and pediatric-specific computer-aided detection systems are needed. So ideally, we would hope that systems trained on available data would generalize well to other adults and generalize to children. But our study is showing that they're not generalizing as well as we'd like to see. So ultimately, we'd like to see some pediatric-specific data available, and then we can train pediatric-specific CAD systems. Currently, there are no publicly available pediatric-specific lung nodule databases or pediatric-specific CAD systems. There's a website called AI Central, supported by the American College of Radiology, that lists all of the available CAD systems that are approved, and these systems, none of them say that they are equipped for pediatric application.
Dr. Hardie, thanks so much again for joining us.
Oh, thank you so much. And I would love to thank my co-authors. They educated me on this problem and were critical in conducting this research and ongoing research. I'd like to specifically thank Dr. Andrew Trout, Dr. Jonathan Dillman, Dr. Aki Tanimoto from Cincinnati Children's Hospital Medical Center, and my colleague Bharath Narayanan from the University of Dayton Research Institute.